Hey guys, and welcome to episode 9 of the Revive Yourself podcast.
Are you sick and tired of being sick and tired? Have you got a health issue that just won't go away no matter what you try? Then welcome to the Revive Yourself podcast, where we reveal the secrets to long-lasting health by getting to the root cause of problems that no one else is talking about. So you can have more energy, clear skin, healthier hair, a leaner physique, more confidence, and most importantly, do the things you love and live the life you deserve. Here's your host, Ryan Martin.
Hey guys, so welcome to episode 9, and today's interview is with Dr. Judene Benoit on how to heal your teeth naturally without painful treatments and procedures. And she's all the way from Ontario, Canada, and it was a pleasure to speak to her. So on the show, there's a little insight into it. We talked about how you can remineralize your teeth naturally, why a cavity might not be a bad thing, and how toothache might mean you don't need a root canal, as well as lots of other great tips to keep your teeth healthy and pain-free. So, without further ado, here she is, Dr. Judene Benoit. Hi guys, I'm here with Dr. Judene Benoit, all the way from Canada. She is a natural dentist. She prefers not holistic, and we can discover why that is in a minute. So, I first heard her speak on Extreme Health Radio, another one of their interviewees, and I was absolutely blown away by the comments she made and her views on how we can actually keep our teeth healthy and actually prevent things like decay rather than actually have to go into the curing side. So, without further ado, hello, Judene.
Hi, thanks so much for having me, Ryan.
That's absolutely fine. So, I want to get people just know a little bit about you, a little bit about your background. How did you actually get into dentistry?
Well, my father's a dentist, and I've wanted to be a dentist all my life. So here I am as a dentist, and I've actually been really fortunate to work with my dad. He's been a dentist for 40 years, and he's been helping people remineralize their cavities or arrest their decay for 40 years. So I've been able to see this really does work, and it definitely can outlast fillings. Like people have areas on their teeth that don't need fillings and really never do sometimes. And that's the goal. That's what I want to help people achieve.
Okay. So, as mentioned a little bit before, you prefer to prevent rather than cure. So you're all about preventing people from having to actually need treatments.
Right. I prefer to prevent or cure, whatever you want to say, as opposed to treatments. So obviously it's great that we have all these advanced technologies available, and all the different types of treatments that we have these days are awesome, and we're so fortunate to have them available. But I prefer to have the treatments, or recommend people to have treatments only when they can't naturally heal their cavities themselves. So the ideal way would be to heal cavities or their teeth from needing root canals or whatever, just to have a strong, healthy tooth or gums and not need to have treatments. That's ideal.
So would you say what are the types of situations that are irreversible, irreparable in your opinion?
Well, so if we're talking about cavities, there are some locations on the teeth where they're much more likely to remineralize or heal than other spots. Certainly size plays a role. So for example, a large cavity in a challenging spot is one where I say, I obviously talk to people about all the risks and benefits, but really that's a cavity that the safer approach would be to get a filling. Whereas a small cavity in an easier to remineralize location, and the person is interested in doing it. It's not for everyone, right? But if the person's interested in remineralizing their cavities, then I think that's a great candidate to try for.
So remineralization.
Yes.
Explain. Most people won't actually know what you mean by that.
Okay, so demineralization is the removal of minerals from the tooth. Okay, so that's demineralization. A lot of demineralization will lead to a cavity. So removal of minerals, not good. Remineralization is putting minerals back into the tooth, and that is good. And that happens all the time. Like literally every day, all of us, our teeth are going through this demineralization, remineralization continuum. But if the demineralization gets ahead of itself, and there's not enough remineralization, then you're going to get a cavity.
Okay.
So yeah, remineralization it's a normal thing. Like every dentist learns about it in dental school. The proper dental terms that we use are remineralization and arrested decay. So if you have a cavity and so that's one huge thing I want to tell people, that people don't realize, that not all cavities are bad.
Right.
So if you have a cavity and it's active, that means there's continual demineralization, continual removal of minerals, and it's growing. So that's an active cavity, and that is not good. But if the cavity is arrested, that means that it's been remineralized and it's been hardened up, it's not progressing, and that is a healthy, healed cavity. I mean, dentists, we don't say, like, the proper terms are not healed or reversed or things like that. We say it's arrested, it's remineralized, and that is awesome. That's a goal of what I want to help people achieve.
Okay. So
an arrested cavity does not need a filling.
Right. Okay. Okay. So, how would you go about remineralizing a tooth?
Okay, so there's tons of different ways that you can go about it. Normal conventional dentistry recommends fluoride. Fluoride is recommended to remineralize cavities. If you don't want to use fluoride, there's a lot of other things that you can do, natural approaches. So my approach that I take, I look at the inside and outside factors. So what's affecting the outside of the tooth, like the saliva, and what's affecting the inside of the tooth, like what's coming into the tooth from the blood, like there's a blood flow into the tooth. And so what's going on from the inside and the outside, and those two, addressing both those things combined is a very powerful approach.
Okay. So when you say coming into the saliva, would that be things people are eating, drinking, etc.?
Yeah. So things like the pH of their saliva. So pH is a measure of the acidity in the mouth. So when the mouth is in an acidic state, demineralization is occurring. Minerals are being drawn out of the tooth, so that's not good. So having neutral saliva, or as close to neutral as possible, is ideal. And then, of course, that's affected by so many things, right? Like what people eat, what people drink, stress levels, their hydration levels, and even like buffering capacity. Like everyone has a different buffering capacity. So like some people will drink a pop and their mouth will neutralize it. Some people will drink a pop or something even healthy that's acidic. Not all acidic things are unhealthy, right? And their mouth will stay acidic. So knowing or testing what your mouth pH is a really powerful tool to help. You can test it with pH strips. They're cheap. They're easy to use. Kids use them. So that's one powerful approach that affects the outside. Another thing is bacteria. So there's the cavity-causing bacteria called Streptococcus mutans. there are tests available in dental offices that test your level of Streptococcus mutans. And if you have a high level, you're at higher risk of getting cavities. You're more prone to cavities. So natural approaches to decrease those levels would involve loading up on probiotics. You want to get the good bacteria, and it's the same with our gut, right? And the same with the mouth environment. So you want to load up on good bacteria to get rid of the bad bacteria.
When you said you can test them with the pH strips, is there a better time of day to do it? Is there a recommended time? Before food, after food, when you wake up?
So I actually recommend that people test like all the time initially. Like take a couple days and just test all the time. When you wake up, before you eat something, after you eat something, before you go to bed, like, you know, just test a variety of times during the day because our mouth pH can always change. And so you'll know if there's any high-risk times, like waking up in the morning is a high-risk time for a lot of people because it can be dehydrated at nighttime, dries their mouth out. So you can find out if that's a high-risk time for yourself. Certain foods, like everyone's different. People always ask me like, oh, is my favorite drink cause acidity, or my favorite foods, or this or that? And my answer is that the best thing to do is to test your mouth, because foods will affect different people differently. And even in a family, like sometimes I'll see parents come in with their children. The children have lots of cavities, and they don't. Like, I don't understand. And then they'll, test their mouth pH, and they're different. And the same foods can affect, even in a family, people differently, right? So the most powerful thing to do is test it yourself. If you have times when your mouth is acidic, like say your favorite drink causes acidity, you don't have to give it up. I mean, if it's an unhealthy drink, then obviously that would be ideal to give it up. But if it's a healthy thing, like, lemon water, everyone always wants to know lemon water. Like, is it alkalizing my body? Like, it's good for you, obviously, but, test your mouth. If it's acidic after you drink something like that, then you don't have to stop drinking it, but you want to, what I say, manually neutralize your mouth. So if your body is not going to neutralize your mouth, then you go ahead and neutralize your mouth. Like, drink some water. Water should be neutral, and it should neutralize your mouth. But if not, then you might, if you have like really acidic mouth, then maybe you need something alkaline to neutralize it. So something like anything green, like green vegetables, are super alkalizing. So you might want to put like chlorophyll drops in your water. A lot of people like that. Just stick a couple chlorophyll drops in their water, and then that'll neutralize their mouth for them. So
would you have to keep it in the mouth, or would you just swallow it? Is that?
Yeah, you just swallow it, and then, or you might want to swish it for a little bit, just make sure it's neutralizing your mouth, and then retest.
Yep.
Retest with pH strip, and if it's neutral, perfect. If not, then you need to make sure that your mouth is neutral before you go on for the rest of your day. And it's not something you need, like, you don't need to continue testing your mouth like all those times during the day for the rest of your life, because then you'll learn. You're like, okay, my favorite drink causes acidity, but if I do this to neutralize it, I'm good. So then you just know that, and you continue doing that. So it's an easy process.
It's I'm quite dark, I'm quite acidic in that sort of area, so lemon drink and green drinks always have a lot of greens. It makes a big difference to me, I know that. But what you just said there, I think, is a brilliant point to bring up. All the theory and all the science in the world, but when you get in tune with your own body, nothing beats it.
Totally.
When you're sensitive. So everyone quoting all these different like theories or research papers, etc. But as you said, everyone's individual. So what works for me might not necessarily work for you, and vice versa. So I think the point you made there is absolutely vital. Getting everyone to be more sensitive towards themselves and really tune into their body.
That's right. Yeah, that's going to be the most powerful things, when you know your body and when you know what's best for you.
It's absolutely fantastic. You touched on it a little bit there when you brought up about fluoride It's quite a big issue, I'd say, in the natural health or world, or just in terms of water, and it's in the water, and they say it's put in toothpaste, and it's actually fluoride. Well, it's not naturally occurring fluoride. It's industrial waste. They put in, and they say it makes your teeth healthier and harder and cleaner. Your thoughts on that? Do you use fluoride? Do you recommend fluoride for your patients?
I personally don't use fluoride. I don't need to. Like I'm so passionate about the inside stuff, like building your tooth strength from the inside out, and so I don't need to use fluoride. Like that's my approach for myself. In terms of other people using fluoride, like I'm really open. Like I really try not to judge people. So there are people out there who do want to use fluoride, and there are people out there who don't want to use fluoride. And I think, my passion is to help people naturally remineralize their teeth and cavities. So that's what I can help people with. And there's some people out there who are experts on fluoride, and so I always encourage people to come to their opinions about fluoride by, educating themselves through those experts who are experts on either side of the fluoride controversy. So I'm not the expert in fluoride, but I'm here to help people naturally prevent and remineralize cavities and the rest of their health of their teeth. If they definitely, some people come to me and they want to use fluoride, I don't judge them, and I try not to judge anyone, right? So these approaches can be used with fluoride or without fluoride.
That's fine. Yeah, it's nicely sat on the fence there. That was nice. That's fair enough. I do understand what you mean. It is up to everyone to educate themselves, really, and to go out there and to learn both sides of the story. So that's fair enough. Now, one of the other questions I was put to me was about root canals, and basically, quite a few people are in a situation where they have been told that they need a root canal by their dentist, and they've heard that they can be quite detrimental to their health. So they don't really want to go down the root canal route. They don't really want to go for a root canal, but they don't know what else they can do, what other options they can take. What would be your take on that?
Okay, so yeah, that is right up my alley. I love the before treatment stuff. So all about naturally healing our teeth before we need treatments. So once you have a root canal, again, there are experts out there on either side of the root canal controversy that I encourage people to come to their opinions about that themselves through those experts. But before they get to having a root canal in the mouth, I love that stuff. So root canals, just like this is what every dentist learns. This is a fact. The process of needing root canal is the first step of that is reversible, completely reversible. So the diagnosis that a dentist would make is called pulpitis. Pulpitis is inflammation of the pulp. So in the middle of a tooth, there is something called the pulp, and that's where blood and nerves are contained. So when that becomes inflamed, that's called pulpitis, and the first stage of pulpitis is completely reversible. The second stage is irreversible. So, and then that's when a dentist says you need a root canal or an extraction if someone doesn't want a root canal. Neither of those are great options. The ideal option is to heal the tooth so you have a healthy, strong tooth, right? So pain is not a good indicator of whether it's reversible or irreversible. I get a lot of people saying to me, my tooth is like insanely painful. It is. Like a pulpitis is insanely painful. So it seems like it's irreversible, but it's not necessarily. Reversible pulpitis can be insanely painful. In fact, sometimes irreversible pulpitis is much less painful than reversible. A lot of people, they're just in so much pain. They're not sure what to even do. So they end up getting a root canal or an extraction when they're still in the reversible pulpitis stage. And that's fine for some people. Like that's what they want. Like that's the best thing for them. But for other people, that might not be what they want. So that's what I can help people with. One of the major things with that is just reducing, like heavily reducing your overall inflammation in your body, and that's going to help reduce the inflammation in your tooth. Like in one of my dental school textbooks, it literally says the blood inflammation going into the tooth is the major determining factor of whether a tooth gets pulpitis or not.
Really? Okay.
Yeah.
Okay. So no, that's pretty cool. That's never even thought about that sort of before. That's absolutely amazing. So how would you go about reversing it? Would it diet and etc. the way they live, lifestyle, that are big factors?
Yeah. So that's those, like living anti-inflammatory lifestyle is a great way. Like, living an anti-inflammatory lifestyle every day is a great way to pretty much avoid going down the pulpitis route. But if someone is in what seems to be a reversible pulpitis, like they have the toothache, there is sort of an emergency situation because they have the toothache, and if nothing is done about it, if it's not reversed, it's going to lead into the irreversible pulpitis road. So what I recommend during that time is heavy for like 2 weeks straight, heavy focus on anti-inflammatory foods and lifestyle. So things like, some things are healthy that can be inflammatory. So, they can eat those foods in the future. But for that 2 weeks when they have what seems to be a toothache that's quite possibly reversible pulpitis, they should avoid those foods. Like, just for example, like healthy grass-fed beef is definitely more inflammatory than, say, fish. So I'm not saying to avoid eating inflammatory foods forever, but make a serious effort to avoid it if you have a toothache, to avoid going down the irreversible road.
So maybe even short-term becoming vegan could even help you there.
Yeah, as long as they're getting a lot of omega-3 fatty acids, right? So omega-3 fatty acids are great for reducing inflammation.
Okay. Olive oil, coconut oil.
Or even flax oil, hemp oil, things like that are
fish oil.
Things that are even more heavily loaded with omega-3s.
Okay.
Like, again, like olive oil, coconut oil, those things are healthy, but they're not going to be as anti-inflammatory as some of the omega-3 oils.
Okay. So apart from that, would there be anything that you would recommend? Or obviously someone probably have to see them, but if someone came into you, apart from the inflammatory lifestyle, anything else that they could possibly do?
Well, stress is huge, right? So having elevated cortisol levels definitely raises inflammation in the body, and so that's huge.
So based on today's world, where people are eating heavily processed foods, high in saturated fats, high in highly inflammatory and allergenic, stressed out of their minds, I'm guessing you've got quite an extensive client list going on right now. That's fair enough. So if someone didn't want to go down, so that's a pre root canal option. If someone was in the stage where it's irreversible and they have to either get a root canal or an extraction, what one would you say? What one would you recommend? What do you recommend to your clients?
Well, again, I don't do either one of those. Like, I don't do treatments, right?
Okay,
so,
okay. So if they didn't want a root canal, would the only other option be extraction rather than getting a replacement tooth? What's it called? A cap or can't remember what it's called. Can't remember what is it? What's it called? Can't remember what it is.
Implant?
What's that?
Implant?
Implant. That's the one. Got there in the end. Yeah.
Yeah, an implant would be something that comes after the extraction.
Right.
So, to my knowledge, there may be other things out there, but just to my knowledge, like normal dentistry knowledge, is that, root canal or an extraction are the only options for treating irreversible pulpitis.
Okay.
And you don't want to leave it. Like, I know it's definitely tempting. Remember I said sometimes irreversible pulpitis is less painful than reversible. So it's tempting for people to leave it. The only thing with that is that it's a drain on the immune system. The immune system is constantly going to be tending to that tooth, and so it's as tempting as it can be sometimes. It's not ideal to leave a tooth that is irreversibly infected.
Yeah, I don't. I think most of us say I didn't realise until I took my journey into the natural health world and literally doing things a little different way, that how much impact on our health our teeth actually have. Well, for example, when we're actually a fetus, the spine and the teeth are actually together as one. So it's they're quite important, and they can play quite a vital role in people's ongoing health. So yeah, as you said, leaving it probably wouldn't be the best option. Definitely go and get it seen to. So just generally, what are the most common things that you see, problems that you get and people need to see you for?
Cavities, root canals, and gum disease.
Gum disease.
Yeah.
Okay. So we haven't really touched on gum disease. What would you do about gum disease if someone come to see you?
Gum disease is also heavily related to inflammation.
Right, okay.
So when we have inflammation in our gums, it will actually destroy the bone around our teeth, and then that's when you hear, older people, they lose their teeth because they have a lack of bone. That's, chronic inflammation in our gums is not good. It's not good for our teeth. It's not good. It's a drain on our immune system as well, right? So, again, another really important reason why we want to live an anti-inflammatory lifestyle every day.
Cool. So, what tips can you give people in general? Living an anti-inflammatory lifestyle, obviously this goes on to show how important living a healthy lifestyle, eating the right foods, trying to de-stress, relax, meditate, living that anti-inflammatory lifestyle, having the right diet is really important. But are there any sort of tips that you can give them in terms of maybe things that people can clean their teeth with, or the best practices or things they can put on their teeth to help them not get these cavities?
Yeah. Well, my tips are sort of related to that, but like a little bit weird, because certainly there are great things that people can put on their teeth, But what I want people to know is that it's like, it goes even beyond that. There are even more powerful things that can be done to have healthy teeth. And it comes from the inside. So we can heal our teeth. Like, and that is, I know that sounds kind of weird, but it's definitely not. Like, literally every dentist learns in school, or at least I learned in school, that these things that people think are irreversible we're capable of healing. Our bodies are capable of healing. And that's what I want people to know, that cavities can, not all, of course, I'm not saying just disregard what your dentist says, but I'm saying some cavities can be healed. Some teeth that are heading towards root canals can be healed. Gum disease can be healed. These things can be healed. And the most powerful thing to do is to know that and to use our own bodies to do it. Because our bodies are way more powerful than anything you could put topically on our teeth.
It's just like refreshing to hear a dentist say that, because I always say about our body has an innate ability to heal itself given the right opportunities, the right circumstance. So that comes back with your teeth. I mean, you can see your teeth are pretty much immaculate from here. So you live the life, obviously. So when you've seen this done hundreds of times, thousands of times. People have come to you with cavities and naturally reversed them, or as you said, I can't remember the term you used, but you've naturally sort of healed arrested
the cavities. Yes. Okay. Yeah. So, for sure.
Yeah, for sure. So, and even to stages of the reversible to root canal. So, yeah. So people do have other options rather than just going to the dentist and having a treatment.
Yeah, and one thing I want to make clear when I say that a cavity has been arrested or remineralized, I'm not talking about the tooth growing back. So that's like an area of confusion amongst people. So when you have a hole in the tooth, a cavity, and the cavity is active, it's no good, but then it becomes arrested or healed or remineralized, whatever you want to say, the tooth structure does not grow back. Okay, so that's an area, like, I think sometimes people should be celebrating and they're still stressed out. They're still expecting like their tooth to grow back. That does not happen. It's like if you cut your fingertip off, and we say your finger's healed, the skin is hard, it's not at risk of an infection, it's functioning like normal, but your fingertip doesn't actually grow back. Okay? Yeah. So that's the same with cavities.
So people, and if they have got a hole there and it's been arrested, people don't have to worry about it.
Exactly. It's okay. Yeah.
So even if food gets into that hole or sugar gets into that hole, they haven't got to worry.
Yeah, so remember when I was saying some locations are easier or more challenging. So locations where food gets caught in and it's not easily cleaned, those are locations that are very unlikely to remineralize in the first place.
Right.
Because absolutely, having a hole that's like a food trap it's challenging to remineralize in the first place. If for some reason it does, you have to keep food out of it. But yeah, usually it's the holes that are easier to clean. They're in locations that sometimes are self-cleaning. The saliva can clean it out. Those are the ones that are most likely to remineralize. And then absolutely they can stay like that. Actually, again, in my dental school textbook, it says that sometimes arrested cavities are actually stronger than the rest of the teeth. Because once it's remineralized, it becomes even more densely packed with minerals and can actually be stronger and more resistant to decay in the future.
Oh. That's madness, I would say, because generally you think people got a hole in their teeth, they'd be quite worried about it. So it's quite a different view to take on board there, that they can just, if there's no pain, no problem, just leave it and get on with life, no?
Yeah, that's right. Yeah. Yeah, and that's been something, like, again, I'm very fortunate to have seen my father's patients, because my father, he sees a lot of different types of people. So it's not your normal dental office where people come in when they have like teeny tiny holes. My dad works on a lot of homeless people, people who are recovering from drug abuse in the jails. And so I've seen some huge areas of arrested decay that I would not have been able to see in a normal dental office. And it just blows me away that tooth is fine. Like, it's a strong, healthy tooth. And it may not look pretty sometimes, but it's healthy. Yeah,
it's madness. It's amazing what the body can do. Just one of the things I actually want for my own personal education was, I wanted to talk to you about grinding of the teeth. So when people wear gum shields when they're playing sport, or when they're lifting weights, or even in the evening when they go to bed, people have been known to grind their teeth. What are some of the things that you can do to counteract this? Or, I mean, is it a massive problem?
It is a massive problem because enamel doesn't grow back. So it's possible to have a strong tooth underneath worn away enamel, but ideally you don't want to wear away your enamel because it's not going to grow back. So there's a variety of reasons why people clench and grind. Some things I suggest to people are to try magnesium, because having tense muscles in your body, definitely tense muscles in your jaw, and people will clench and grind more. A lot of people are magnesium deficient. So I know myself, I use magnesium oil on my body, and it really, I notice a difference. So that's something. I mean, being deficient in any nutrient can cause repercussions in our body, right? But magnesium is one that a lot of us are deficient in. And then also there's the stress component as well. A lot of people go through some. It's really unfortunate, because when they're going through like a really bad time in their life, it's like, what's the saying? Like, when it rains, it pours.
Yeah.
You know, they're going through some hard times, and then they're not eating so well. They're stressed out, high levels of cortisol, depleting their body of the minerals, the few minerals that they're getting anyways, and they're pounding away at their teeth. A lot of people end up breaking their teeth and, losing their teeth. It's some sort of stress relief is a great idea, and also the nutrient, making sure you're not deficient in any nutrients. Sorry, go on.
No, sorry, I didn't want to interrupt you. I was just going to say, do you get people to wear gum shields at night or anything like that? Is that something you...
Yeah, I wear gum shields. Is that what...
I don't know what you might call them.
Yeah, we call them night guards.
Night guard, okay. So,
gum shields, I like that. Night guards are great if people are working at everything else. Like a gum guard or a night guard is a great option. But I do say, like, I strongly suggest people to make sure they're not deficient in any nutrients or like crazy stressed out. If they're working on those other approaches, then night guard can really help.
Oh, that's awesome. Well, that's basically all the questions I have for you today. Been absolutely fantastic listening to you talk. I think people will probably learn quite a bit. I know I have, especially about how you can remineralize your teeth, and not to worry about cavities. I say not worry about them, but you don't have to be completely alarmed if you actually have got a hole in your tooth and you're not in pain. So Thank you for coming on and speaking to me. It's been absolutely brilliant. I just want to say you can contact Judene at www.judeds, so it's JUDENEDDS.com.
Yes.
How would you say that?
Judene DDS.
Judene DDS, right, of course, yeah, brilliant, which is absolutely fantastic. If you just hold on the line a little bit, minute there, I'll just end the call. So, guys, it's been absolutely fascinating talking to Judene. Hope you've learned something, and I'll see you on the other side. So, guys, that was episode 9 of the Revive Yourself podcast with Judene Benoit. So, hope you enjoyed that. I'm sure you got a lot of good information there, especially, the teeth are so important to your health. It's a part that often gets forgotten, and they are so crucial to your health. They both come from when you're born. Your spine and your teeth are actually together, and they branch out, and it's why they always go for dental records to even find out who people are, because it is a very, very important part of you. And so hopefully that's given you some great tips how to take care of them naturally and how you can heal them naturally. So as always, any questions, or if you want to contact Judene, then you know what to do. Next week's show is with Hilary Boynton, and it's all about gut health. She's brought a book out called She brought a book out called The Heal Your Gut Cookbook, and it is a really good show. So hope you got something today. I'm sure you did, and I look forward to seeing you on next week's show. Stay happy, stay healthy, and I'll speak to you soon.
If you're struggling with gut issues such as gas, bloating, constipation, diarrhea, indigestion, heartburn, and want to finally be able to eat the foods you love without the crippling after effects, then don't forget to head over to reviveyourself.co and pick up your free copy of The Healing Health Paradigm today.